Tonight, a little boy in St. Johns County who beat cancer is facing a new battle, not with his health, but with his health insurance. Since Cigna and Baptist Health Jacksonville parted ways in late June, families like Griffin's say they've been left in limbo.
Popsicles were always a favorite.
At just 3 years old, Griffin Anderson is a cancer survivor.
Back in 2024, April, my son suffered a fall, and from that fall, we found out that he had a rare, aggressive form of cancer called Ewing sarcoma, and that was in his left arm.
Griffin underwent 9 months of chemotherapy at Wolfson Children's Hospital in Jacksonville.
Midway through treatment, he had an arm amputation to take care of the cancerous tumor.
After chemo came the news his family was hoping for.
So far, everything has looked good, and he's been cancer-free since finishing treatment.
But Griffin's fight isn't over. Every 3 months, he needs a CT scan to make sure the aggressive disease hasn't returned. His mom says getting that critical follow-up care has become a battle of its own.
Last month, Cigna, which is our insurance company, went out of network with Baptist, which includes Wolfson's Children's Hospital. And Wolfson's Children's Hospital is the only pediatric hospital in Jacksonville. There isn't anywhere else to do pediatric scans.
Catherine Anderson says the next closest in-network provider to get her son's pediatric CT scans is Nemours in Orlando, and that's a 2-hour drive.
The anxiety of not knowing where the scan can take place is just overwhelming.
We reached out to Cigna, and one day after we interviewed Anderson, she got a call from the health insurer saying Griffin's next scan at Wolfson Children's Hospital has been approved.
I'm relieved that we've got this approval. I'm glad that we're going to be able to do it here, but I'm frustrated that it has taken, I've probably spent 20 to 30 hours on the phone over the past several weeks just working on this. And there's a lot of parents that don't have the time to do that.
A Cigna spokesperson sent us a statement saying in part, Griffin currently has an approved continuity of care arrangement through September, allowing eligible covered services to continue at the in-network benefit level during this transition period. Cigna says it's working with the family and providers to evaluate Griffin's care needs beyond that period. Wolfson Children's Hospital says it has dedicated teams working directly with affected families like Griffin's to help them complete forms required by Cigna, understand their options, and advocate for continued access to medically necessary care. Anderson says the relief is only temporary. She says she'll have to seek approval again from Cigna for Griffin scans after September and fears each one could bring another battle.
And what is your message to Cigna right now?
I just want them to come back to the table and talk to Wolfson's and get in the same room, talk to each other, figure it out. These are kids. Like, as an adult, if I can't use Baptist, I have other choices. My kids don't have other choices.
Now, according to Cigna, Baptist Health left its network in June after declining an extension while the two sides worked to finalize a new agreement. Cigna says it accepted Baptist's proposed financial terms and maintains Baptist can rejoin the network by signing the agreement. Baptist Health says it proposed lower reimbursement rates and significant concessions, but said Cigna sought contract terms that would give the insurer more control and over coverage and medical necessity decisions. Baptist Health says it remains willing to negotiate a fair market-based agreement that protects patients' access and keeps medical decisions between patients and their providers. You can read the full statements from both Cigna and Baptist Health right now in this story on the First Coast News app. And I do want to point out that Baptist Health and Wolfson Children's Emergency Centers are available 24/7. Insurance companies are required to cover emergency services at an in-network rate.